All right. PTSD and emotional therapy with Amy Wagner and LCSW-C. So again, still Aortic Disease Awareness Month, and dealing with a traumatic event can be very scary. It can be very overwhelming. Whether you're the caregiver, whether you're the patient, whether something was scheduled, whether something was an emergency, these events going far back. I mean, it doesn't have to just be your aortic disease. It can be the first time you ever got an IV and it causes trauma that you're not even aware of. But eventually you can figure out that that's where maybe you might be overly sensitive to needles when you're an adult, et cetera. It can cause PTS, post-traumatic stress. It's not necessarily a disorder that's going to last with you, but it can cause post-traumatic stress in and of itself. But we want everybody in the community to just acknowledge when they feel certain symptoms and push through the hard times, but don't feel like you have to live with that. There's plenty of therapists that specialize in PTSD, not plenty that specialize in EMDR therapy, eye movement desensitization and reprocessing. That is a specialized therapy that Amy does do. She's the clinical director. Has a lot of variety of PTSD therapy she can do, but she was trained in EMDR. And so EMDR, which we've talked about this a few times, we have a video of a live event that we did with her that you can check out. EMDR, let's just sum it up real quick. When you go to sleep at night, everything that you've seen during the day gets processed, gets downloaded like a computer, like that you're doing an upload. So you go download, upload, you know what I mean. When you go to sleep and you go into REM stage and your eyes are going back and forth, that's when your brain is putting the things it's seen, smelled, tasted, everything, all your senses. It goes into files, file folders, and they get downloaded. But every now and then there's a glitch. There's a little weird thing that happens. And that's when you've seen or experienced or tasted something weird. The brain says, oh, this is different from everything else I've had in files. So if you have seen car accidents before, they get filed. If you see a car accident and somebody flies through the windshield, that's going to get filed a little differently. And sometimes the brain, whatever it's smelling, tasting, touching, at the moment that you see this, gets remembered not necessarily correctly with the right emotions. So when you feel or see or taste something, you might all of a sudden start having flashbacks to what you experienced, or vice versa. If you find that you're at a red light, you might start smelling things and hearing things that necessarily are not there. And that's because your brain downloaded what it experienced with a little wrinkle, like a little crinkled folder paper, you know what I mean? And now it's got to get straightened out. And the way to straighten it out is to have this EMDR therapeutic event. And what it is the therapist will put you in a quote unquote REM stage, but you're awake. So how they do that is, let's say they have you hold paddles that vibrate. Well, if anybody came over behind you and touched your shoulders alternating and your eyes were closed, your eyes would move because you're feeling a sensation. It's the same thing with the paddles. When you close your eyes and a right paddle goes off, your eyes will move to the right and conversely to the left. It's just a natural reaction. Well, that's forcing a REM stage as you think about the event that you experience. But now your brain knows it's in a safe place and knows that it can try to download that in a different environment with appropriate emotions. So now when you pull up to the red light, the theory is you should not be smelling or hearing or tasting or anything that doesn't exist, because you've now processed what you experienced with that car accident. Okay. So with medical trauma or sexual trauma or emotional relationship trauma, whatever the trauma is, they're able to have you talk about it. So you're going to discuss it and then have you close your eyes for intervals and think about this. And then the brain should download that information, that memory appropriately. I thought this was all a bunch of like Mr. Miyagi stuff from Karate Kid. And then I tried it after hearing a couple people in the community say that it really did wonders for them. And it did wonders for me. This is scientifically based therapy that is usually paid for by insurance. And it was amazing. Took about 6 weeks and the triggers substantially decreased. The nightmares went away. So if I was left with some insomnia, then it becomes, is it menopause or was it PTS? I don't know, but everything got better. So I highly recommend that if you feel that you're having nightmares, seeing things, smelling, tasting things that don't exist, reoccurring thoughts, replaying that loop over and over again. If it's bothering you and impacting your day-to-day life, go talk to a therapist. I am not a therapist. I'm just reading an article, just sharing information. I'm not a doctor. I'm just sharing, information that's been written by hospitals and other physicians. Take the information that you hear or read back to your own physician. Ask for the name of a specialist. It doesn't necessarily take long to fix some of these issues, but you should not be left struggling. That's the point.
That's well said, Karen. Terry
Thank you
wants
so
to chime
much.
in and say, I miss you too. And then she says, remember that PTS can come up unexpectedly. And I said, very
Yes,
true.
it can.
Sudden
Yeah.
onset acute anxiety attack. I
Yeah.
like that you shared
That
the
is true.
triggers and how that they went away, or at least they lessened. But I
Hmm.
think that that's the first time that you told me how long it took. I think that's the first time I've ever heard you say
Oh,
that it
really?
took about 6 weeks. Yeah.
Yeah. It probably would have taken less, except I'm going to be honest. Like about 2 weeks in, I started having some headaches and some anxiety anticipating the appointment because I just was nervous and didn't want to have to think about it. And so I stopped going because I was a brat. And then I finally admitted to her that I just stopped going. And she said, you just really need to trust the process. So I went back in and then I gave it 100%. And she was right. It wasn't, it wasn't uncomfortable. It wasn't comfortable for me the first couple times, but then it was wonderful. It was great. And I learned a lot. I learned that what I thought in my experience caused the trauma wasn't the example I used a few moments ago about the IV. That's what it was. When I was in fourth grade, I had my tonsils out and I had my first blood draw ever that I remember. And they hit a nerve and it hurt really, 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 really bad. There you go. So it even went further back when I was 4 or 5. I slid into a slate coffee table across my eye. I needed to have stitches. And I remember that like it was just now getting that first Novocaine stitch or whatever it is, the lidocaine. And that hurt. So that's where all of the health related goes so far back into the not being able to be in control and having pain associated with not being in control and being able to stop anybody that's trying to help me. It really wasn't anything related to my dissection. That all got triggered from past experiences. So once you work through that, and I realized rationally, well, that's the mind of a child, you know, we only have so much we can control as children. I was able to move past a lot of what I thought was really bothering me from the vulnerability of the dissection. They'll even do it for people if you're scared of spiders. They'll work through all of that. I am not doing that. I am not doing desensitization and no, because we had to do desensitization with alcohol because I used to smell alcohol everywhere. I mean, it freaked me out. So one day she and I were talking, and without me noticing, she just cracked open a packet and just was kind of sort of waving it by her side. And I start smelling alcohol, and she's like, "Go with it. Just keep focus on me, and let's just talk. Let's just talk with the smell of alcohol in the room." So that my brain realized the alcohol's not coming to get me, and it's not going to kill me or hurt me. It's just a smell, and that's what my takeaway finally was. It was just a smell. It was just all of those emotions were so heightened because my brain didn't know what to do in bad experiences. So yeah, it's just fascinating. And if you go into things with that mindset that this is going to be really interesting and fascinating, I think you really might get a lot out of it. So
I like that
yeah,
it's like rubbing alcohol that you're talking about. Because when you first
yeah.
said it, you're like, I had to do
Sorry.
desensitization training for alcohol, and I'm like, that seems like
No,
a really good time. Like
no, it was definitely
getting taught
rubbing
how to drink.
alcohol.
No, 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 that's not what we're talking about.
Should have. Yeah, I should have been much more clear. Rubbing alcohol. Yeah. All right, we're moving on.